Hey everyone! Today we're going to talk about something that affects millions of people, but often gets shrouded in silence. We're diving into erectile dysfunction and premature ejaculation, and specifically how they are so much more than just a physical issue. It's all about that deep connection between the body and the mind. So let's get right into it.
So, let's start with a number that might surprise you. 40%. Yeah, research suggests that up to 40% of men deal with symptoms of erectile dysfunction at some point. That is a huge number, and it tells us something really important right off the bat. If this is something you're dealing with, you are absolutely not alone. This is a shared human experience.
So, yeah, let's talk about it. Openly. No stigma, no judgment. We're just going to take a really straightforward look at the science and the psychology behind erectile dysfunction, which you'll hear called ED, and premature ejaculation, or PE.
We've got this broken down into 4 main parts. First, we'll get on the same page with some clear definitions. Then we'll look at the physical, biological side of things. After that, we're going to dive deep into the psychological impact, which is huge. And finally, we'll pull it all together and see how the best treatments are the ones that address both the body and the mind.
Okay, so first things first. What exactly are we talking about when we say ED and PE? Let's get some clear definitions down, because these conditions can be pretty complex.
All right, let's start with erectile dysfunction, or ED. Now, the key words here are persistent or recurring. This isn't about one-off night where things don't go as planned. We're talking about a consistent pattern that gets in the way of having a satisfying sex life because of issues with either achieving or maintaining an erection.
And what about premature ejaculation, or PE? Well, the official definition is actually really specific. It has 3 main parts. It happens within about a minute. It's a pattern that's been going on for at least 6 months. And this is the most important part. It causes real distress. That's what separates a clinical condition from just, normal variations.
And what's super interesting here is that PE isn't just one single thing. There are actually 4 different subtypes. You've got lifelong, which means it's pretty much always been there. Acquired is when it shows up later in life. Natural variable is just that. It happens sometimes, but not always. And then there's this fascinating one called subjective, where someone thinks they have PE, but their actual timing is totally normal. That one right there really shows you how powerful the mind is in all of this.
Okay, so now let's switch gears and talk about the body. Let's look at the actual biological machinery. How is all of this supposed to work, and what can go wrong?
When everything is working correctly, it's actually a pretty incredible biological process. It all starts with a stimulus. That could be a physical touch or even just a thought. That triggers your nervous system to release a chemical called nitric oxide. Nitric oxide is like a signal telling the smooth muscles in the penis to just relax. And when they relax, the arteries open up and blood rushes in to fill the erectile tissue. It's this perfect, precise chain of events.
So it makes sense that if anything disrupts that chain, you're going to have a problem. And there are a lot of physical things that can get in the way. Things like cardiovascular disease or diabetes can mess with your blood flow. Neurological issues can interfere with those crucial nerve signals. Even certain prescription drugs or lifestyle choices, especially smoking, which really narrows your arteries, can be a major factor.
But here's the thing. It's rarely just about the body. So now we have to talk about the mind, which plays an absolutely massive role. This is where a physical issue can start to spiral and become something much, much bigger.
I love this quote because it captures the psychological side of things perfectly. It talks about an ever-expanding snowball effect. Think about that. A sexual issue almost never stays contained to just the one person. It can start to grow, picking up anxiety, self-doubt, and relationship stress along the way. It becomes this snowball, rolling downhill, just getting bigger and harder to stop.
And you know what fuels that snowball? These things psychologists call cognitive distortions, which are basically just negative thought traps, like all-or-nothing thinking, where one bad night makes you feel like a complete failure, or fortune-telling, where you convince yourself that it's going to be a disaster before you even start. These aren't just harmless thoughts. They create real physical anxiety that directly messes with your performance.
And this is how you get trapped in a really brutal, vicious cycle. The fear of not performing, what we call performance anxiety, can actually become the very thing that causes the problem. And that, of course, leads to all sorts of emotional distress, like shame and embarrassment, which then just fuels even more anxiety for the next time. See the loop? The mind gets stuck, and it just makes the physical problem worse and worse.
So, if the problem involves both the body and the mind, it stands to reason that the solution has to too. And that brings us to the modern, integrated way of thinking about treatment.
After all of that, this is the million-dollar question, right? If you've got physical things tangled up with this psychological snowball effect, where do you even start? What's the best way to actually make a difference?
Well, the data on this is it's incredible. Check this out. One study looked at treatments for PE. The group that only took medication doubled their ejaculation time after 24 weeks. Pretty good, right? But the group that combined that same medication with behavioral therapy, they quadrupled their time. That's not a small difference. That is a game changer, and it proves how much more powerful it is to treat the body and mind together.
So today, the best approach is really a whole toolkit. It might include medications, sure, but it also has to include things like therapy to work on that anxiety and break those negative thought patterns we talked about. It can also include behavioral exercises to help you feel more in control, physical therapy for your pelvic floor, and of course, those really important lifestyle changes.
So if there's one thing you take away from all this, let it be this. A good, comprehensive diagnosis is everything. You have to figure out what's really going on for each individual person. Is it a physical issue that's causing anxiety, or is it anxiety that's creating the physical problem? You have to know the answer to that before you can find the right path forward.
And this quote just wraps it all up perfectly. It says the best approach is a bio-neuromusculoskeletal psychosocial one. I know, that's a mouthful, but it just means looking at the whole picture. The biology, the nerves, the muscles, and the psychology. It's about recognizing that all these systems are connected, and you can't fix a problem in one without considering all the others.
Which really leaves us with one final thought to chew on. Given how deeply connected our minds, our bodies, our emotions are when it comes to sex, maybe it's time we stop treating sexual health like it's this separate, isolated thing. Maybe it's time we start seeing it for exactly what it is, a vital, integral part of our overall whole body health.